I'm Steve White. Today we're going to talk about what is chemotherapy, and I'm going to try to help you understand a little bit. Some of it may seem very simple, but I'm going to go ahead and just assume we don't know anything. Well, first of all, what is chemo? And chemo is basically a cancer treatment. And some people call it chemo, some people call it chemotherapy. It's the same thing. So how does chemotherapy work? Chemotherapy works by killing cancer cells because cancer cells grow very fast, and so it can pretty much target those cells. It'll also kill some of the healthy cells that grow fast, like the hair cells or the lining of the mouth or the lining of the intestines, and that's what causes some of the side effects. And those side effects usually get better over time, sometimes even during the chemotherapy, but over time most of the side effects will end up going away. Okay, so what does the chemotherapy do? Well, in some cases it'll cure it. And what do you mean by cure? Cure means that it eradicates the cancer out of your system. So the doctor can literally say there's no more cancer left, and the doctor can say, and the cancer is not going to come back. Secondly, chemo can control cancer, okay? What that means is that it's going to effectively go in there and stop the growth of the cancer and sometimes get it to reverse, but it won't go away. But nowadays we're seeing a lot of patients that are started out to be what they called terminal, but now they call it chronic because they're able to control the cancer. How is chemo used? For a lot of you, it'll be used in concert with radiation therapy or biological therapy. So it can be used with other treatments that the doctor is going to do for you. But sometimes it's used individually on its own. Many times chemo is used preparing for a surgery, okay, to shrink the tumor so that they can do a better job in the surgery. Sometimes they use chemo after surgery just to go in there and make sure that the cancer is all cleaned up after the surgery. The doctor took the cancer out and they want to make sure that there's nothing left over. And as we said earlier, sometimes it's used in concert with radiation therapy or biological therapy. So chemo has a lot of different ways that a doctor can use it. One way they use chemo is when the cancer is spread, when it's metastasized. And it's amazing what they can do with chemotherapy. You'll hear a lot of things out on the street that chemo's not good for you and what have you. But I'm telling you, I see patients all the time, and I'm not a professional, we're just coaches, we see a lot of people. But I see people where the cancer is metastasized, and the only way they can chase that cancer down is with chemotherapy. They can chase it down throughout the body. It's a therapy that doesn't have to just be located in one spot like radiation. How is your doctor going to use your chemotherapy? Now here's the really interesting insight, real deep thought. He knows, okay? We have to realize that this guy's gone to school for years. If he's an oncologist, it's amazing what these people know. He knows by looking at where your cancer is on your body, how much cancer you have, how advanced the cancer is, and he's done a lot of research, and he has compiled a massive amount of knowledge. So trust him. This is a guy that you're going to trust to attack the cancer. He's the guy that's in charge of that part of your program. You're in charge of the other 23 hours. But when you're with your doctor, you trust him to do the best that he can possibly do. So, you know what? It's just like in sports. You don't go in and tell the guy, you better do a better job. Not very many people are encouraged that way. The way to encourage your doctor is to go in and say, thank you so much for what you're doing. Is there anything else I can do to help? Okay, so just a little bit more on how does he choose what type of chemo to use. Well, again, he knows, and it's fun for us to learn, and it's fun for us to try to understand, because you are, at the end of the day, in control of your own life here. So it's fun to know the information, but he's going to make choices on what type of cancer. There's certain chemos that are very good for certain types of cancer. He's going to make the choice on whether you've had cancer before. Sometimes they like to switch chemos because it's almost like fooling the cancer. The cancer may get used to one chemo, so they come in with another chemotherapy and keep the cancer guessing. But he's the one that's taking on that battle for you, and he knows what he's doing. So again, believe in him and try to do everything you can to help him. Some questions that we get as coach advocates when people come to ourhomegame.com is they'll say, so where am I going to go to get chemotherapy? Again, that's kind of a big question because it depends on what kind of chemotherapy you're going to get. It depends on what part of the country you're in. There's lots of different ways. Some of you can get chemotherapy at home. Some of you will have chemotherapy where it's a rub-on chemotherapy. Some have it through an IV, some have it orally. There's different ways which again will affect where you have chemotherapy. A lot of you will go right into an oncologist's office and sit there and have it once a week, but it's different ways with different chemos, and your doctor will help you understand that. You just need to ask your doctor or nurse, and of course they'll explain that to you. The other question that we get lots of times in chat or message to us or even on the phone is, how often will I get chemotherapy and how long will I take chemotherapy? And again, remember, these are things that we're going to find out from your doctor. We as coach advocates are going to help you understand. But some people will get chemo once and get 3 weeks off and then take chemo again. Other people will go week 1, week 2, week 3 with chemo and get a break week. There's different ways, and your doctor knows. What we want to do is make sure when you're in your meeting with your doctor that you write down what his plan is. And then you can come back and share it with us at ourhomegame.com. You can share it with your family, and we can research what type of chemo he's using and how often he's using it. And like I've said in other videos, is this the standard use for it, or is this something he's doing a little more advanced for you? We find those things out. But as far as how often you're going to get it, only one person can answer that, and it's going to be your doctor, and believe that he knows what he's doing. This is probably another crazy question that we get, is people will say, can I miss a dose of chemotherapy? Again, your doctor knows. But I can tell you just from my perspective of seeing people is that if you're going to do chemotherapy, do chemotherapy. Go after it. Go after it with everything you got, and you don't want to get behind a curve. You're on chemotherapy because he thinks he's got a chance to be successful in what he's doing with you. Okay? You don't want to mess with his pattern, how he's got it set up. And so I've seen patients where they've missed one session of chemotherapy, and it's really caused problems in how the whole doctor's got everything set up. So do your best to do what the doctor says and follow how he's got it set out, and take every session very, very serious. Okay, one of the last questions I get is, how am I going to feel on chemotherapy? And I get a really deep answer. I don't know. I say that because people feel all over the map. There's people who take chemotherapy and they feel fantastic. So don't go in with a preset in your mind that, boy, I guess I'm going to be really, really sick. You don't know that. And our program, many cases, can really help you understand how to stay feeling healthy and feeling good. And then from there are side effects, okay? But everybody's side effects are going to be different. This really is patient specific. That's where your coach advocate can really help you understand one side effect versus another side effect. But first of all, I want you to understand, don't go in with the preset in your mind, this is going to be miserable. It doesn't have to be miserable, okay? Go in with the idea that the doctor is going to beat this thing. And this chemotherapy is amazing because it's going to go and beat the cancer. So this is an exciting time. When it's not as exciting as sometimes when you can't be treated. That's kind of a scary time when they say, I can't treat it. So if you're getting chemotherapy, this is an exciting time.